Hello and welcome to our latest webinar. Since the last webinar there is a national lockdown in England, Wales has come out of its fire break and many areas of Scotland are increasing in the tiers that their local protection levels are suggesting. Northern Ireland is also at a tightening of its restrictions. So hearing from people across the countries, I'm getting the sense that it isn't as scary for people as the first lockdown. Of course we are a bit more practiced at coping with being more isolated, schools are open for most pupils, and more places of work are keeping going. Even so, it is a period of increased stress, uncertainty and change, and in this webinar we will cover some of the simple things we can all do to help get through lockdown and beyond. And of course there is some good news too. The vaccines that are becoming available give us all some light at the end of the tunnel, but more about that at the end. Firstly, some of the things that you should all now be doing without thinking. So taking your medicines regularly as you've been prescribed. Try and reduce the impact of triggers on your lungs. So if you're a smoker, speak to somebody about getting the help that you need to stop. Speak with somebody at your GP surgery or visit the NHS website to find support in your area. And get yourself booked in for the flu vaccine as soon as you're able to. Follow local and national guidelines about what you can do, where you can go and who you can meet. Wash your hands regularly with soap and water or hand sanitizer for 20 seconds or more. Keep wearing your face mask or face covering when you're around people from outside of your household or bubble. And keep your distance from anybody outside your household as much as you're able to. And work from home if you can. If at any stage you think your respiratory condition is getting worse or is worrying you, do not delay. Contact your GP surgery or 111. Even though they are doing things differently, they are still open. I'm regularly asked about whether what we eat is important in keeping our lungs healthy and for us staying well. So firstly, being overweight can make it harder for us to breathe. It puts pressure on our lungs and puts more strain on the muscles that help move us around. We know that being obese can increase asthma attacks and also causes things like acid reflux from the stomach into your gullet. Acid reflux can cause coughing and make it more difficult to breathe even if we don't feel the indigestion is there with it. If you're underweight, speak with your healthcare professional as they can give you the advice on what you need to do to help try and keep your muscles strong and build your body up so it's healthy and can support your breathing. If you have lost weight quickly or unexpectedly, speak urgently with your GP's team as this can be a sign of some serious underlying illnesses. Fruit and vegetables, freshly prepared food and plenty of water will give the body the nutrients it needs to stay well and boost your immune system. Although sugars and fats are essential sources of energy and nutrients for our bodies, too much of these, and alcohol, are a bad thing as they can create more work for the body and toxins. Staying active is so important for everybody, but especially for people with respiratory diseases. Having a respiratory condition or chest symptoms can make it mean that people find it more difficult or even get afraid to exercise. Any exercise can be helpful as exercise has effects on different parts of your body, especially if you're doing them regularly. Because your breathing gets faster in response to exercise and this helps to improve how well you're able to get the oxygen into your body. You'll start to use more of your lungs and the muscles that support our lungs, which means that you can start to breathe more efficiently. Your heart will work faster so your body becomes more efficient in getting the oxygen to other parts of the body that need it most. And this also makes your heart stronger. Using your arms, your legs and other muscles also makes those parts of your body stronger and helps them to use the oxygen in a better way, much more efficiently, so that over time your heart and lungs need to work less hard to keep those muscles working. Being active also helps boost the immune system, helps you burn calories and helps to keep a healthy weight. The other benefit of being active is it encourages the body to release feel-good chemicals called endorphins, and this can help you to feel a sense of well-being and can boost your mental health. So COVID-19 has been stressful for everybody and for very different reasons. Even if you have not been directly affected by COVID or it hasn't affected you or your family getting the virus, all the worry, the restrictions, the changes we've all had to make to our lives and even the constant negative news can have effects on our mental health. As you would expect, every day the surgery I work gets lots of calls from people with mental health issues. At least once every day I'm speaking to one of my patients who delayed calling up about their mental health as they thought there were people out there with much greater need. But like most health conditions, mental health issues are easier to deal with if you treat them earlier. Sometimes a brief chat to the doctor or nurse is all that you'll need to get you back on an even keel. And usually I signpost people in the direction of some reading, some websites that can help, local and national support services and counselling. Occasionally medicines are useful in helping to rebalance the chemicals in the brain that cause depression and anxiety symptoms. General practice is open for business, so if you're struggling, we want to know and we want to be able to help you. Spend some time as well looking at the Asthma UK and British Lung Foundation websites. Both have some brilliant links to organisations that can help you with your mental health. And these include Every Mind Matters, Mind, the Mental Health Foundation and the Samaritans. Finally, there is one thing that we're all missing out on to some extent due to these restrictions, and that is human contact. Some people need human contact more than others, and some people are used to a lot more than other people. To have that reduced has an impact on our mental health and how we survive. Make time to connect to other people. It may be as simple as saying hello to someone in your street or when you're out walking, or calling people you haven't seen for a while because of coronavirus. Whether it's somebody you're worried about or just haven't seen much of recently, give them a call. And if there's lots of people on your list to call, then spread out your calls rather than exhausting yourself. And it doesn't matter whether it's a phone call or a video call or a socially distanced walk. I bet it'll help you to feel better, and more likely it'll help them too. At home, we've certainly found that the video call still feels novel when we're calling our relatives, but it does seem to brighten up a chat and boost everybody's mood. So, now for some good news to end with. You've no doubt heard that on the news, that the great news that COVID vaccines are coming. The science is looking very positive. The vaccines developed so far appear very safe and very, very effective. We're waiting for the regulators now to have a look at all the results before they approve the vaccines for us to use. The NHS has been told to get ready to start giving the vaccine at the beginning of December. It is likely to be a couple of weeks after this, but we're all making plans ready to go. We'll get more detail about who will be invited in for the first vaccines and second and so on shortly. But what we do know is that the vaccines produced so far need 2 injections a few weeks apart. By having the vaccine, you'll be protecting yourself from COVID-19, and if we vaccinate enough people who work in care and healthcare and the people who are more vulnerable to the effects of COVID-19, we can keep our NHS services open for longer, and the government will be able to start relaxing their restrictions more and more. Hand washing, face masks and social distancing will still be a thing even with a vaccine, but hopefully by seeing a reduction in the numbers of cases, the number of people needing a hospital for COVID, and the number of deaths, I expect the government and public health teams will be trying to relax the restrictions so we can all get back to some normality. I hope they also do some good work to try and combat the fake news that we're seeing around vaccines. All the doctors and nurses that I've spoken to about this are looking forward to having the vaccine, and I know they're going to be recommending it for their patients. So keep an eye on our website, keep an eye on your GP surgery website and their details, and what we'll do is we'll try and keep everybody updated so we know what's going to happen when. But it's very fast moving at the moment, but it's definitely good news, so watch this space. See you soon and take care.